resolution and payment are affecting workers and employers?
I'm here to actually, the first thing is to talk about the quality of the qualifications of medical interpreters in the workers' compensation system. As of last year, nationally certified interpreters were recognized by the state, yet to this date, the insurance companies and agencies in California are selecting non-certified interpreters to interpret in workers' comp sessions. They're doing it against the law. They're providing their own interpretation. The law clearly states that a certified interpreter is that one who is qualified, and also that one that is qualified is that one that is certified. However, the insurance companies and agencies are not doing this, and they're instead sending non-certified interpreters to interpret. The second thing I wanted to talk about is HIPAA violations within the workers' compensation system. When a patient needs the assistance of an interpreter to fill out a questionnaire, he usually has to do it in the waiting room full of patients that may or may not speak the same language, and there's no conversation going on between them two. And the third thing is that I wanted to mention is that we desperately need a fee schedule. It's long overdue. It will save the state a lot of money. It will also save agencies a lot of time that they spend fighting for those liens, and also it would improve the attendance of the interpreter when it comes down to servicing a patient. Thank you.
For having me here today. And I'm also a certified medical interpreter, and there's several topics that I want to talk about. And the first one being is in behalf of a few of the doctors that I have spoken to, and they wanted me to pass this over to you. And it is that, that the amount of claims that are being denied is excessively high, and even procedures that are required in order for the doctor to be able to provide the treatment that the patient needs, beginning even with diagnostic testing and even treatments that are required, or even medications, which make it so much more difficult. So while the report would state that there is quite a large amount of money that is being designated towards chronic pain, if the patient would be receiving the prompt care that they do require, it definitely would translate into a reduction of further treatments and also of chronic pain. Also, because of such delays, many times the patient not only has further complications in their physical condition, but also in their emotional condition. And that is, of course, another big impact. Doctors have also mentioned to me that many times during the independent medical review, they make use of nurses, of registered nurses, to do such independent reviews, and many times the medical records are not reviewed on time, which make it so much more difficult. And these patients, even after such appeals and such, are still being denied claims and treatment that they do require. Talking about the rate, please keep in mind that the last time that we had any kind of fee schedule for interpreters was back in 1994. We were talking about 20 years ago. Everybody knows that today's economy has changed. Expenses have increased, and pretty much as an interpreter, it would be impossible for me to live in a city like San Francisco. It's extremely difficult. So we urge you to please keep that in mind.
I'm an independent interpreter. I'm a court-certified interpreter. I work in Los Angeles and flew up here this morning to talk to you folks because I think it's important for the independent interpreters who don't own a language service, aren't a language service provider, don't own an agency, and very often aren't members of a union. Those independent interpreters are primarily the ones who are working in the workers' compensation system. And from our point of view, and I think I'm speaking for most of my colleagues here, the issue of certification is very important. The issue of compensation is very important, and the long overdue raise in the California court per diem rate, which is the rate of compensation that is called out in most of the DIR's references to what interpreters make, right? That rate hasn't been touched in over a decade. So using that rate as sort of the touchstone is, probably not a great idea. And we're petitioning for that rate to be increased, so maybe that'll trickle down. The other thing that I wanted to sort of draw your attention to is the notion that the interpreter's business model is going to be impacted by 863. I think that's a welcome condition, because the interpreter's business model that is reflected in the statutes currently, right, states that the half day is 3.5 hours, and that the market rate should be taken into account. All of those conditions don't really reflect our day-to-day working condition. The 3-hour half day, the 6-hour full day is the way that most interpreters work, and I know my time is up, but I'll wrap it up very quickly. The Berkeley study will hopefully, call some of these things out to light, but I just wanted you guys to hear from somebody in the trenches. And
Thank you very much.
Thank you.
Good afternoon. It's nearly impossible to ask an interpreter, which is what I am, a 2-minute, because we're in the business of talking, right? So basically, I just wanted to mimic and to echo what my colleagues here have said about how we work in the private sector. I am the unit chair for the Translator and Interpreters Guild. We are affiliated with the California Federation of Interpreters, who is one of the largest federations, professional divisions that represent over 600 interpreters in California. We would welcome our comments that we had prepared, and I'm hopeful that they were in receipt of them when we submitted them. If not, we will do so again. We would love to be able to participate in part of these studies, to give our feedback on how we feel what we're looking at from our perspective, and as my colleague said, from the trenches. And basically trying to come up with a solution that is doable for everyone involved. We understand that a lot of the insurance carriers are mentioned as to perhaps certifying interpreters. That's something that we are very concerned about, especially this stringent process that we have to go through to become certified. So in closing, I would just like to request the possibility that TTIG, along with CFI, be able to give some of our comments and feedback on this very, very important study that affects all of us. It's very important.
My name is Deborah Marchevsky. I'm a certified Spanish interpreter, and I'm here as part of the interpreter community, and I'm representing all languages spoken in California. I want to direct my comments to the meaning and the relevance of market rate in the fee schedule for interpreters. As we know, the world in its majority is driven by market forces, both nationally and internationally, and only the countries with a free market economy have adequate living standards. So as interpreters, we believe that in a state where 45% of the population does not have English as a first language, the intention to cheapen the value of the interpreter's work would not only affect the outcome for the injured workers, but hurt the local economy at the expense of big business that will only make their fortunes larger. The umbrella of market rate allows discretion for fees for interpreters in the non-certified languages and can also allow adequate coverage throughout the large, extensive geographical areas in California. Those areas have great demand and very little supply of interpreters. The Berkeley Research Group, to which we have contributed an enormous amount of data, has failed to answer us in that regard. What should we do with the difficulty in demand versus supply? Furthermore, cheapening the professional and certified interpreters' fees would only lead to dumbing down the whole profession. No one wants to do the same work for less money. A bad or mediocre interpreter who gets paid little money will have a direct and deleterious effect on medical treatment decisions, on medical rating decisions, on deposition transcripts, and actions of the board. So as the state of California, as we all are state of California taxpayers, we interpreters ask why the state favors this scenario.
I'm going to ask you to summarize your remarks.
Yes. We urge you to keep market rate in place to guarantee the constitutional right of the injured workers to have equal access under the law. This can only happen when skilled and certified interpreters that care about the profession are fairly and adequately compensated. Thank you very much.
Marina Herrera, I'm a state certified interpreter, court, administrative, and medical. I would like to call to your attention, please, page 20 of the DR report. And I just think that, I'm hoping it was just an omission, but it seems to be quite misleading, the fact that it says that unless an interpreter is certified, the claims administrator will be selecting the interpreter. That is not what the regulation says. The regulation specifically says that if a certified interpreter is not available, then the claims administrator could certify the interpreter. Why is this important? It's important because at this time in California, many injured workers, unfortunately, are receiving subpar interpreting services. Why? Because when the certification came into effect, there's not enough tests being given to the people who want to be certified. So at this moment, there's not enough certified interpreters. I live in the area code 925 Tri-Valley. There's only 3 of us. And you're going to tell me there's only 3 encounters a day? I don't think so. I think that you need to take into account the fact that the injured worker is the one that is suffering right now. The fact that the law says that they're entitled to an interpreter. They should be able to hear and speak the same way that an English speaker can. And that is not happening at this moment. Please take into account the fact that many interpreters are leaving the profession because they are not receiving adequate reimbursement, and it is continuing to happen. Thank you.
And right now, I wanted to talk to you also about the MPNs. Unfortunately, the way that things have worked, especially when it comes to us interpreters, is that there has been a monopoly that has been created by one large agency called One Call. Insurance companies are not taking California smaller business and smaller agencies to also provide the services of interpretation. And this has definitely had a huge impact on the way that services are being provided. As I mentioned before, they said that the adjuster or the claims administrator is in the obligation of furnishing an interpreter that would be qualified. This person, this claims adjuster, has no way of verifying that that person does effectively have the qualifications to be able to provide such interpretation. And you would expect also agencies such as One Call to do their due diligence in finding a certified interpreter. I'm a certified interpreter. I worked for a little bit with One Call, stopped working with them, and ever since they have not done any kind of outreach to contact me to see if I would like to provide any of those services. And I know that they're sending unqualified, uncertified interpreters to appointments that do require a person who will effectively interpret what the patient wants to say, and as well as the doctor, or even in some cases the attorneys. With this being said, I also want you to realize, please, the impact that this is having on Californian business, because One Call is an agency that is based out of Florida in Parsippany, New York. This company, which is out of state, is taking so much of the business that is actually from Californians, for people, our taxpayers over here. And I don't think that's fair. When a lot of these Californian agencies try to belong to these MPNs, the response is that they need to have national coverage. This is about California. This is not about the entire state. So I want you to reconsider, please, what is the purpose of law?